of what's going on. But each one of the channels has its own individual kind of line on the screen. 1, and then there's a whole bunch of buttons, 2, a whole bunch of buttons, 3, etc. Okay? So, Ani, you're sitting right there. I want you to press channel 1. I want you to press the button that says quick 1. Okay, now, I want you to tell me what electrical modality is that?
Rate, it's 180 to 150 hertz, so it's tens.
Okay, but what's occurring? What waveform is that? Do you see it in between 1 and 2?
Oh, interferential.
Right. Okay. So this machine shows you a little waveform. It shows you the kind of clover-looking waveform. There's a little squiggly line that's coming out of the line number 1 and the line number 2. Okay, so that's showing you that 2 channels are being used, and it's the clover waveform. And Anya just read off that the pulse rate is 80 to 150. So what modality is that? IFC. Okay? So that's what channel 1, if you push quick 1, defaults to IFC. Okay? So Anya, press cancel down at the bottom. Okay. Martha, press quick 2. Channel 1, quick 2. All right, what's that? So pulse rate is 100 hertz. Pulse duration is 50 microseconds.
10.
Right. What type of tens?
Acute.
Or
Conventional.
Good. Or high rate, right? So pulse rate is 100. Pulse duration is 50 microseconds. Okay, so remember your ranges for tens, 100 to 150 pulses per second for your frequency, 50 to 80 microseconds, right? All right, press cancel for me. Peter, channel 1, press quick 3 for me. All right, what's that?
It's tens, but low rate.
Look, the very, very top.
Oh, no, that's NMES.
Right. How did
Yeah.
you know?
Because it has on and off time. The frequency is 50. Normally it's between 35 to 50, and
Yeah, it's microseconds.
yeah, I know, 10, 50,
Well, it's
100.
100, 50, 100. So that just
100,
means that
yeah.
the pulse duration modulates throughout the course of the treatment. Okay, but quick 3 is your Russian setup. Okay, and when you come to this machine, I want you guys to go through what we just went through with 3 individual people. Press quick 1 and look and say to yourself, how do I know what this is? Press quick 2, look at it, say, how do I know that this is tens? Press quick 3, how do I know, looking at the screen, that this is what I'm going to use for Russian? Okay? Alright, so with this machine, what you're going to do is you're going to set up your electrodes, you'll plug them in. There's nothing to change. It defaults to 50 pulses per second at a modulated pulse duration for an on and off time of 10 seconds on, 50 seconds off. There is no changing it. It's set in the machine, that's all. Okay? So this is sometimes not the best machine to use with your patients, because if they accommodate or you don't get the outcome, the stimulus that you were looking to get, there's nothing you can do. Unlike with a machine like this, where you can increase frequency, decrease frequency, all of that. So, and you can change your on and your off time to progress your patients. This you can't. This is Russian protocol. That's it. Okay? So once you have your electrodes set up, what you're going to do is you're going to spin this dial. All right? And it's not a take your hands and slowly do this. It literally has to be a pretty quick spin of this dial. When that happens, you'll see down here that there's a little readout where a bar will start to slowly increase and darken and show you how many milliamps you have of current running. But again, we don't care about the number on the machine. We care about what's happening with your patient. So as your finger is spinning, your eyes should be on the target tissue of that which you're contracting. Okay? Once you see the twitch or the contraction, you're going to depress this knob. Okay? Then what's going to happen is there's going to be a little question down here at the bottom. It's going to say, save this treatment for next setup or something along that lines. Please always hit no. Because if you hit yes, then there's all these other steps you have to go through to save the protocol for the next patient, and it just takes way too long. So if you hit no, it will automatically start the clock and start the treatment. Okay? When you depress the button after setting the max current, you press the button, the patient will go, oh, wait a minute, it's gone, it went away. Yeah, that's what's going to happen until you answer that question no, and then the clock's going to start, and the time and the ramp is already preset in here. Okay, so it will ramp up, contract. After 10 seconds, it will relax. Okay, so that's this machine, the TheraTouch. Nothing to edit. Okay, and then the last one we're going to talk about is